quickly than I had anticipated. I rise tonight to speak about the GP tax that the Abbott government wants to impose, one of the harsh, cruel measures in its recent budget. And I particularly want to focus on the effect that imposing a GP tax will have on Aboriginal community-controlled health services, and I'll focus on those services in Western Australia. The AMA recently was at the National Press Club, and it too was condemning the government's intention to introduce a GP tax, and certainly not for selfish reasons. And I think when fairly conservative bodies like the AMA come out and criticise government, then government surely must realise that its proposals are well and truly on the nose. But the AMA said that whilst our universal health system was not without its faults, the president of the AMA went on to say it's one of the most efficient and highly performing health systems in the world, and that's an amazing approval rating from GPs and specialists. The AMA president said, and I quote, "It is a system that is worthwhile protecting, improving and investing in for the future." End quote. The AMA say there are some key foundation aspects of our healthcare system, and those go to three key areas which the AMA say that we as a country must value and guard. So the first key function of our health system is that it is a universal health system. The second key function of that is that everybody has access. And the third key function is that it's affordable for those on low incomes. A GP's ability to bulk bill patients who cannot afford out-of-pocket expenses is an important part of encouraging access to health care. That was again one of the planks that the AMA thought was critical, the doctor's ability to choose whether or not to bulk bill a whole practice or patients in particular. As the AMA says, the independence of the doctor-patient relationship is sacrosanct. And in order for doctors to provide the best care, they've got to be free to be able to order tests or prescribe a course of treatment without worrying that patients won't be able to afford the treatment because of the imposition of an additional cost by government. And I further quote the AMA president, "The lack of protection for vulnerable patients and the multiplier effect of pathology and diagnostic imaging co-payments threatens the universality and affordability for healthcare for the neediest and the sickest in the community." End quote. And this proposal, this GP tax by the Abbott government, goes against the grain of conventional health policy. That is, encouraging people to see their family doctor for measures such as vaccination, although if you believe what you read in the media, the government seems to be backing away from that, and the monitoring of problems such as the silent killer of hypertension. This GP tax especially jeopardises policies that support the efforts to improve Aboriginal health and to close the gap. It penalises those with chronic disease. And the government's response to questions from Labor about its GP tax are laughable, if only the consequences of the tax weren't so dire. The Assistant Minister for Health, Fiona Nash, has repeatedly said in this place, it's up to doctors what they charge. And whilst the Assistant Minister might fiddle with the truth, there's no doubt that the Abbott government wants to impose a GP tax on patients. And if doctors choose not to impose this tax, they lose out on their rebate. So the government's ideology to slash and burn Australia's universal health system is a lose-lose deal. If doctors choose not to impose the tax, they lose. And if they do impose the tax, patients lose. A difficult decision for health providers to make, and one that the Aboriginal Health Council of Western Australia has considered and made a decision about. The Aboriginal Health Council of Western Australia is the peak body for Aboriginal community-controlled health services, and it supports 20 services in Western Australia. The Council has undertaken an impact and risk assessment on the Commonwealth budget, and more recently, the Council announced that the WA Aboriginal community-controlled health services won't charge their patients the $7 GP tax if it's implemented. Now, this is a bold and brave move by Aboriginal community-controlled health services, as it represents a $2 million loss in revenue, But they made that brave and bold decision out of concern for their patients and the outcomes for patients. That's what's motivated this tough decision. These WA health services have more than 60,000 registered clients, of which 50,000 are Aboriginal clients. And in a year, they undertake over 200,000 clinical appointments and 400,000 occasions of service in just 1 year across those 20 WA Aboriginal community-controlled health services. These health services believe that the GP tax will affect their patients, and despite that loss in income, that massive $2 million loss in income that they will suffer by not charging the GP tax, they're going to go ahead and implement that measure in any event. Aboriginal community-controlled health services are also concerned by the introduction of a new form of checking by the government, a new Medicare item number called a MIN, M-I-N. That will be used by the government to track the number of individual visits to doctors. Doctors' visits will be tracked under the Abbott government's GP tax by the Department of Human Services. And whilst the government may argue the collection of the number of doctors' visits is necessary in order to trigger its 10 doctor visits before the threshold to enable Medicare rebate to kick in, it is nevertheless an invasion of privacy, and currently there are no individual doctors' visits counted in our health system. And this will be the first time any government will be able to track the number of GP visits individuals make. And I can imagine the Abbott government in a year or two saying, oh, well, you know, there's an overuse of doctors here because we deem that perhaps 10 visits a year is enough. And the minute you get to 15 or 20, somehow the overuse comes in. And who knows into the future that that charge of $7 will creep to 8 and up to 10 and up it goes. So in making the decision to not collect the GP tax, these Aboriginal community-controlled health services will lose around $2 million a year based on their current client load. No organisation or association working in health in Australia supports the government's proposed GP tax. And what's more, the government, in its usual fashion, has failed to provide any data or research to support its GP tax. And of course, it is either another broken promise or an outright lie by the Abbott government that there'd be no cuts to health and no new taxes. The key theme of the Abbott government's harsh budget has been its attack on those who can least afford it and those least able to defend themselves. And we know that Aboriginal Australians have poor health outcomes. And I would plead with the government, it is time to drop the GP tax. It is a tax on the sick, it is a tax on the poor, and it's an attack on our universal health system, which the Australian Medical Association says is one of the most efficient and the best in the world. So let's give our Aboriginal community-controlled health services back their $2 million and to not make Aboriginal health outcomes worse in our community.
Thank you, Senator.